Now we're going to demonstrate 4 types of exercises that are really effective to do in pregnancy throughout your entire pregnancy to help keep the body strong and stable to support a growing baby. In the first group of exercises, we're going to talk about integrating the breath to keep the core and the pelvic floor healthy. The second group of exercises will be for the glutes. The third group will be for the upper back muscles. And then fourth, the last group will be core exercises. This first exercise for pregnancy is called the connection breath. This is going to keep the core and the pelvic floor nice and healthy through our whole pregnancy and set us up for a successful postpartum recovery. Amanda is going to demonstrate. We're doing this seated in pregnancy, especially through the later stages, just if being on the back, flat on the back, isn't comfortable or you can't take a nice full breath in that position. So we're seated on something stable where we can feel the sit bones rooted into what we're sitting on. So Amanda is going to pull the flesh away from her glutes so she can feel those sit bones. And then we're going to put one hand on the side of her rib cage and one hand low under the belly. So this is perfect right here. We have a nice seated alignment. We have a good arch through the lower back. She's not flattened her lower back or she's not sitting on her tailbone, compressing that tailbone. So from here, Amanda is going to take an inhale breath and gently breathe into the hands. And then on the exhale breath, she'll just feel this gentle falling down and in of the belly and her rib cage. We'll flow through this. So inhaling into the hands, we feel this expansion through the side of the ribs. Exhale, we fall down and in. And we'll do a few more, really feeling this relax and release of the pelvic floor through the inhale breath. So this is perfect when you're seated on the bench like this and you can feel your sit bones. You're almost going to feel like you're filling up the space between your sit bones. They get wider as you inhale, and then on the exhale you might feel them just soften back down and in. So inhale, we fill up the breath, sit bones feel like they're getting wider. Exhale, we come back down and in. Now we should note, at this stage of pregnancy where you're later in the 3rd trimester, you're starting to prepare for birth more, we are not going to do many or any pelvic floor contractions or Kegels. At this stage, we're really training the pelvic floor to relax and release, which will help us in birth. So I'm not going to cue or coach Amanda in this later stage of 3rd trimester of pregnancy to pick up her pelvic floor or squeeze her pelvic floor tight. I'm just going to train her to feel release of tension in her pelvic floor on the inhale breath and nothing further in the exhale breath. And that is our connection breath. The second group of exercises for pregnancy are for the glutes. This will help to keep the pelvis and the low back nice and supported and stable as we get more pressure and growth of the baby in through the body. So this is really nice to keep strong glutes throughout our whole pregnancy, just to keep the body more comfortable as we move along. Amanda is going to demonstrate a supine glute bridge. She starts supported on her side. She will roll to her side first, and then she's going to roll to her back. So side to back, perfect. So to set up for the glute bridge, we have this nice line down the body. Her feet are planted, maybe just a tad wider, hip distance apart. Perfect, heels are in line with the body. And from here, she's going to take a nice inhale breath. Exhale, she's going to squeeze her bum, lift her hips up. Perfect, not too high, just this nice straight line down the body. Inhale to release and relax back down. So again, on her exhale breath, she lifts up, straight line down the body. That rib cage isn't flaring. She's not pushing her belly up. We're just staying supported and strong and back down. Great, so if we are feeling comfortable in this position and we want to take it up a notch, make it a bit more challenging, we're going to put the heels elevated up onto a bench or a stable surface. So for this one, excellent, and if we can just scoot your bum in a little bit, that's great. So I'm gonna have Amanda flex her feet, again, hip distance apart. I want her to flex her feet and put pressure downwards into the bench the whole time. We have this good neutral spine position again. Her bum isn't pressed hard into the ground. She's not flattening her back into the ground. We just have this gentle arch in the low back. She's gonna exhale, squeeze her bum, lift her hips back up into that glute bridge position. Beautiful. And then straight back down. She'll feel her tailbone touch all the way. And then we're back up again. Squeeze through the glutes, the bum, and back down. We'll do one more. Pressure down into the bench while the hips lift up. Excellent, great. So the goal isn't to go as high as you can. We don't want tension in the low back from pushing the hips up extremely high. We want to move from the hips and the glutes just to there, straight line, and back down. Beautiful. So we'll roll out of this to the side first before we move on to our next exercise, which is the hip thrust. And for Amanda, she is going to roll into this one because her upper body is now going to be elevated. So she can either decide which is more comfortable for her. She can, get her shoulder blades hooked on the bench almost, and then just lift her upper body on top of the bench, or she can roll into it, and we can show both actually if we want to. So this is one way she could get into it. We'll put her bum back down, or if it feels more comfortable, she could start on her side, get her shoulder blade on top, maybe just a little bit more, perfect, and then support herself as she rolls to her back. Either or. We just want to make sure we're not crunching and flexing on the belly a lot, getting into and out of this position. So for the hip thrust, we are going to get Amanda's shoulder blades on top of the bench just a little bit more. I like to hook the bottom of my shoulder blades on the bench, and then hands behind the head to support the neck in this position. And then we set up exactly as the glute bridge. We can walk the feet forward just a tiny bit, perfect. Feet are nice and straight, or they can be slightly turned out to the side. So Amanda's upper and lower body are gonna move together as one unit. She's gonna dip her hips down towards the floor. She's gonna squeeze her bum on her exhale and lift the hips up, glute bridging again. Inhale, we're gonna return back down, upper and lower body moving together. Exhale, squeeze, lifting up. Perfect. We'll do one more time. So remember, she's not going to lift as high as she can to crank on the lower back. It's just, yeah, perfect. It's just to there, just so we feel a lot of tension in those glutes to lift the hips. No pressure or pain in the low back. And then we're down and relaxed, and we can roll to the side to get out of this exercise as well. So that are our glute exercises to be doing in pregnancy. The third group of exercises are used to strengthen the upper back, which will help us as we start to gain more weight on the front side of the body in pregnancy, and just to keep good alignment through the whole body as we progress along. The first exercise is what we call a band pull apart, and Amanda is going to demonstrate. So we have a resistance band here that we could use with just the one loop for it to be a little bit less challenging, or we could actually double it up to create more challenge. So either way, we're gonna set up in good standing alignment. So we want to be nice and tall, and we are going to squeeze the triceps to keep the elbows nice and straight. And then I'm also gonna get Amanda to straighten her wrists right out, perfect. So we keep this long and flat as she pulls the band. So she is squeezing through the upper back muscles around the shoulder blades to pull apart. And then she's coming back into the middle again with those nice straight arms. Squeeze and then release back in. One more. Squeeze to pull, shoulders down the back, and relax back in. So that is the band pull apart. The second exercise will be a single arm exercise, and this is going to be a one arm band row. You could also use this on a cable machine. We're gonna demonstrate with the band, and because we don't have anything to anchor the band to, I'm gonna be the anchor. I'm gonna hold the band for Amanda, but you could always loop or wrap your resistance band around a squat rack, cable machine, or anywhere that it is secure and supported. So we back up here. I hold steady. Amanda is going to take her feet just hip distance apart, bend her knees slightly, and she's gonna make sure she's not tucking her bum under. Her bum is just behind her, so we keep that good position of the pelvis and the low back. So Amanda is gonna take an exhale breath. She's gonna row her arm back and then straighten it out and in. Good. So we're really focusing on moving through the back muscles, through the shoulder blade to pull, and then releasing back in. We don't want Amanda to wing her elbow backwards and her shoulder blade forwards, great, because we just create too much stress on the shoulder joint. So we'll do one more, pull, and then return back in. Great, so that's our one arm band row. Our third exercise is a one arm dumbbell row. We are doing this elevated, as Amanda is showing to be further along in a pregnancy here. So what we want to make sure is when we're elevated that we're not feeling stress or strain on the abdominals. We're not feeling pain in the belly button or along the linea alba, like our abdominal muscles are just doing so much work to support the belly, or that we're falling out the front of the belly. It just feels supported through the abdominal muscles. So this is why we're elevated as we get further along in pregnancy. So we have one hand supporting on the bench, feet are hip distance apart or even a little bit wider. Amanda's going to soften through her knees and stick her bum backwards, and so she's in a bit of a hinge position. So we'll just hinge her back, perfect, and then we can straighten out this arm. So maybe just walk backwards a tad. Great. So on her exhale breath, she's going to do the same rowing action. She's going to pull up and in, and then return back down. So she squeezes through her back muscles around and under her shoulder blade and straightens her arm back down. We'll do one more. Exhale to pull, bums reaching back, and relax. Perfect, and then you can just stand yourself straight up from there. So again, if this feels like too much pressure downwards on the belly in this position, we would just stick to a more upright row with a band or a cable machine. But if this feels comfortable through your second or even the beginning of your third trimester, you can still perform the elevated dumbbell row. Our fourth group of exercises for pregnancy are core exercises. These are exercises that you might think are more traditional abdominal exercises, where you'll feel the work and the tension more so in the abs. So we are going to do a half kneeling Pallof press and a side plank. These exercises are great because they're safe to do throughout your entire pregnancy, whereas others we would only use in the first half or maybe 3/4 of pregnancy, and not to these later stages, which Amanda is in now. So the Pallof press and the side plank we can complete through the whole pregnancy if we are feeling good and supported in the core and in the pelvis. So Amanda is going to set up for the Pallof press in a half kneeling position. So we have the band anchored onto something secure. And then she's going to keep her inside knee down on the ground. She's going to bring her other leg up in front, so she's in a mini lunge position. So we have 90-degree angles on the knees on both sides, front and back. So we are rooted through the feet down into the floor. Amanda is going to squeeze her back leg glute, and as she does this, we want to make sure that her rib cage didn't go backwards. She actually has her rib cage still directly over top of her pelvis. So when we squeeze the glute, don't lean back. Keep the ribs over the hips. From here, she's going to pull the band in front of her chest, right to her sternum. We're going to make sure she's stable in this position. She doesn't feel like she's going to flop to one side or the other. On her next exhale breath, she's going to extend her arms straight out in front of the body, perfect, and return on her inhale breath. So we have the glute squeezing still in the back. We exhale, we feel some tension in the core, in the abdominals to keep her body stable, because this band wants to pull her back in and rotate her body. And she comes back in. We'll do a couple more. Exhale to push. She squeezes her tricep muscles as well to get full extension of the arms. And back in, one more. Ribs are over the hips. We push and return back in. So in this exercise, we feel tension through the core and the pelvis to keep the body stable and not rotating side to side. In our next exercise, we're going to do the side plank. So Amanda is going to make her way down to the floor. She's supported on her side. Perfect. So the first demonstration we're going to show is side plank from the knees, and this can be great as we get further into that third trimester when there's more weight in the belly and it doesn't feel quite as strong and supported lifted up into a side plank. So we have the knees bent and together, the feet together. we have her shoulder shifted right over top of her elbow in her forearm. She's not sliding away from it. She's directly over top. And then Amanda's gonna use that hand on the floor, her right hand, to help lift her body up off the floor. Perfect. Great line down the body. She's gonna squeeze her bum in this position and make sure her hips aren't rocking backwards. Rather, they're just forward, straight over top of hips are in line. Top hip over the bottom hip. We'll do one more time, side plank from the knees, straight over top, bum squeezing, long line. She's breathing well, and then we control back down. So if you are earlier in your pregnancy, or maybe you even still feel like you can perform the side plank really nicely with legs straight, we're gonna do that more challenging version now. So again, great line down the body, legs are straight out now, feet are together. We're gonna use that top hand to help lift us up. Again, we have a lot happening in the belly and the core. Squeeze the bum, breathe, we're long through the chest and the neck, and then return back down. We'll do it one more time. Shoulder right over top of that elbow, lift, hold, hips are stacked right over top of one another, and control back down. So those are our core exercises that can be safe through an entire pregnancy, the Pallof press variation from half kneeling, and then side plank from the knees and from the feet. While strength training and exercise is fantastic in pregnancy, there are some things we want to avoid. The first thing to know is this is trimester by trimester dependent. So things will change a lot in your exercise routine probably from the time you're in your first trimester until the time you get to be later in your third trimester and up into your birthday. So in the first trimester, your exercise routine might look really similar to what you were doing before if you were strength training and exercising previously. It might change just a little bit depending on your energy level, how much food you're eating, nausea, vomiting. So it could change in that regard, but your exercise selection might look very similar. In the second trimester, we have a lot of changes happening throughout that 12-13 week period. So things might stay pretty similar again in that first chunk of your second trimester, but then once you hit maybe 20 or so weeks, your exercise selection might be starting to change. You might be taking out some front-loaded exercises such as planks or push-ups where you're supported on the hands or the upper body and the belly is facing towards the ground or the floor. That might start to feel like there's too much straining, tension, or pressure in your belly. So we like to call this the hands-free mama. If you feel like you're doing push-ups or you're doing front planks and you almost want to take your hands on your belly to support it up and in, this is probably a good time to regress that exercise to lift the upper body up onto an incline to support yourself, or maybe you just want to stop doing these exercises at that point. So front-loaded exercises, again, you can start to regress them as you move further into the second trimester, into the third trimester. And then another thing we want to be aware of is when the belly starts to grow as we progress through pregnancy, we want to notice if it's starting to bulge outward in different exercises. You might even see this as you're lying back on the floor, which we will show you the more optimal way to do this to get up and down off the floor. But if you just lie back, down on the floor to do an exercise and you see this almost doming or ridging throughout the midline of your belly, you might see that the abdominal muscles are starting to separate slightly. And while this is a normal occurrence of pregnancy, we want to decrease the severity of the strain and pressure on the linea alba and also that separation of the abdominal muscles. So we want to avoid exercises that are causing the belly to bulge outward to keep those abdominal muscles and the whole abdominal wall safe and supported. And we also just might be placing too much downward stress and pressure onto the pelvic floor. And it's a good indication if your belly is bulging outwards that we're also creating some downward stress onto the pelvic floor and the pelvic organs. So watch this as you move through that later second trimester and into the third. And the last thing that I want you to be on the lookout for is how high impact exercises such as running, sprinting, jumping, skipping rope are just making your pelvis, your core, and your lower back feel. So this might be absolutely fine for you. Again, first trimester into the second, doing some running, you might not feel much difference at all through your core and your pelvic floor. But as you get further along, the abdominal wall and the pelvic floor muscles are just under more stress, and we don't have as much ability to support them as well. So those high impact activities could be causing some pain or pressure in the front of your pelvis, the back of your pelvis, your low back. Potentially you might be feeling like you're having some incontinence happening, some leakage of urine during those exercises, so we want to avoid that. And just anything that is causing your body to feel stress or pain during or after the exercise. So just note, exercise and strength training is absolutely fantastic in pregnancy. We want to keep going as long as possible, but just watch how you feel trimester by trimester. Your exercise selection will start to change and shift. Watch the bulging of the belly, avoid that, and also start to cut back on your front-loaded exercises and your high impact exercises.